So here we are getting off the elevator at NYC Pain MD, a Midtown division. And this is right coming out of the elevator, and you'll see the access and the sign. And you'll see that we are in suite 1603. All right, well, let's take an office tour now and go ahead in. Oh, here we go. So here we are entering the office. And there's the front desk. And you can see the lovely reception area. Lots of nice chairs. Lots of reception area. Coffee area. Water. Filtered water. And we can see down the hallway here we have all our procedure and evaluation suites. Right here is the front desk area. And let's go take a look through the office. All right, and here we see we have indoor, in-office rather, x-ray availability. All these x-rays are done digitally. They're very low dose. There's all sorts of protective x-ray gear to keep the x-rays minimal as possible, but these are high-speed, low-dose x-rays. And they pop up right here on a computer, right here on this screen. Within seconds after they're taken, we can do hips, shoulders, knees, ankles, necks, whatever needs to be taken right here in the office. You don't need to be referred out. And here we are, coming back into the hallway. All right, and we're gonna take a look at the initial examination room, okay? And we have several of these here in the facility. Nice comfortable chairs. And this is where the doctors will consult with you, take your information, may do some evaluation, and go from there. Okay, and here we are walking from one of those consult rooms into a procedure area. What you see here is technically called a fluoroscopic C-arm. Right here on this computer is the double screen on which your treating doctor will be precisely watching the entry of the apparatus, which applies medical lubricants, stem cells, platelet cells, nerve blocks, etc. And it's called the C-arm because basically the arm that swings out is a C. Let's get a better look. All right, so here we are taking a really good look at the C-arm, and there's a very good reason they call it a C-arm, because you can see it's a sideways C, and the area in question, the treating area, goes in between this head and this one here. It could be a shoulder, an ankle, a knee. Certainly if you have a hip, you have to be laying down, or a spine. And of course, this C-arm is connected to those computers we talked about. So we're watching, it's like a live, active motion, digital procedure. So this helps guide all those medicines exactly where you need it. When you have arthritic and damaged joints, of course, those are very difficult to get accurately into, like threading a needle, so to speak. So going in blind makes no sense when we have all this wonderful technology. You see this chair in the back. This is a chair that goes up and down, so the doctor can get the patient at the right height, depending on the size and so forth of the patient. And of course, here we have all our computer technology that goes in these corners, and sinks and so forth, all the normal things you'd see in a procedure room. Again, of course, this is all right here in our office. This is not somewhere where you have to leave the office and go to a surgical center or a hospital. All this equipment is right here in the facility, right here at 57th Street, easy access, and easy to get care when you need it, right on the spot. Okay, so this concludes our tour for today. Next time, we'll get the doc doing some procedures and possibly chatting with some patients about their care programs.